us? Do they know they're live?
Assume they heard us.
Do you all know we're live right now?
Yep.
All
Okay.
right.
So we're live streaming now, guys.
Put all the party stuff away.
Oh, there's an echo.
You're delayed.
Yeah.
All right. So we're live streaming now, guys.
Oh, it's delayed.
Put all the party stuff away.
It's delayed.
No,
You're delayed.
this is open and it's replaying the video from live. That happens sometimes.
That's gonna be weird. We'd be hearing ourselves all.
Double.
Okay, we need one more person to have a quorum.
No, you got
Yep.
3.
Dean's on.
Oh,
I think he's muted.
I'm
I
on.
don't, oh, okay. All right. Well, then, heck, let's go ahead and call the meeting to order then. First thing, agenda. Did anybody have any additions or
Type in with
I'll
public
type.
comment.
changes?
I have nothing.
Okay. Get a motion to approve the agenda.
I'll make that motion.
All right. Second? I'll second it. All in favor? Aye.
Aye.
Okay. Approval of minutes. I guess I didn't see anything that needed changed. If anybody else had discussion on the minutes. Nothing. Motion to approve.
Julie, you're muted.
Julie still on?
We can't hear her.
Maybe let me put in the chat. Julie?
She's talking.
Julie, we can't hear you. Oh, you're muted again.
Nope.
No.
Nothing. Let me quick chat to her. Oops. Ow. I'm going
I
off
can
the wrong
send you-
keyboard.
Motion's been made, correct?
Yeah.
I can second that motion. Keep things moving.
Okay. But Dean, you made the motion, right?
Oh, I made
So
the
I'll
motion on
second.
the agenda.
Okay, I'll go ahead and second the approval of the minutes.
Okay.
So all in favor, Julie, I don't know, we might have to have you call in. Either that or when you have something to say, you might have to type it. Because we're not, for some reason, there must be, your microphone connection must be disconnected or something. So all in favor of approving the minutes? Aye.
Aye.
Dean, you approved the minutes. Okay. Julie, do you want to type if you approve the minutes? Just put a yes or a no. Julie, can you hear me? Okay. All right. Okay. Let's go. Oh, setting the date for the next meeting. Just maybe in the interest of, since there's only 3 of us, do we know if Dr. Heim or Art is going to be able to make it?
Art reached out to me about 15 minutes ago for the link again, so I assumed he was, and I
Okay.
was unable to get a hold of Dr. Heim.
Okay. Well, then let's just go ahead and set the next meeting date, and then when they get on, if they have any conflicts with that, we can change it. What are we looking at? We're in July now. Is it going to be August, or do we need to have one before then? or September, I mean?
Yeah, it'd be September.
Okay.
The Thursdays would be the 3rd, the 10th, 17th, and 24th.
Okay. We've been trying to kind of stick with the second Tuesday, haven't we? I know, Carrie, you had, or second Thursday, sorry. Carrie, did you have conflict with a second or a third Thursday?
Not right now because of COVID, nobody's meeting. So I think normally when the Northwest Iowa Sanitarian Group gets together, it's that second Thursday, but they're not getting together right now. So I guess it's up to you. If you want to set it for the 10th, that's fine. And then if something comes up, then I'll just.
Well, why don't we, I don't see any urgency either way. Why don't we just in case you have that meeting, should we just say September 17th?
17th won't work as well for me as the 10th would.
Okay.
Just do the 10th, it's fine.
Okay.
They're probably not gonna do anything, and I don't go to every one of those meetings because they move it around, and if it's way up in Northwest Iowa, I don't go anyway.
Okay.
So it's the 10th is fine.
All right. So we'll go with September 10th. All right. Paula.
Good afternoon. I was just going to provide a couple program updates. The first one is with WIC. There are new income guidelines that went into effect for July 1st. So we always get all that information out. We've done some Facebook posts. We've emailed it to all the coalition members and local public health just to get the information out there. Along with that, there was also some updates to the Iowa WIC food package that came along July 1st. I think they're pretty exciting, actually. Some of the things that got added was store brand or name brand peanut butter. They also added whole wheat pasta, whole wheat hamburger, and hot dog buns as an additional option for them to choose from. And they added, the one they added that is more of the, what I want to say, squeezable tubes for yogurt. So I think that'll be great for our WIC moms. It's a lot more convenient. They've added canned beans, and then probably the most exciting one is they actually added chocolate milk to the WIC food package. So they can only get 1 gallon per month on their food benefit, but it is a good option, at least for those kiddos who don't consume a lot of milk. So those are the food package changes that came on board July 1st. The other thing I just wanted to mention is we do have our information out on our our annual children's health clinic that we hold in August. If you remember, that's our free children's clinic where we do physicals, lead screenings, dental screenings, just as a gap filling service in the event. This year may look totally different with COVID, but historically, a lot of times, you know, our parents may wait till the last minute and then our clinics get full as far as scheduling some of those well child visits. And so we kind of started, this will be our 6th year, and we started it just to kind of as a gap filling service. So we'll still be holding that. It won't be a walk-in clinic. It is by appointment only, just to accommodate everything that has changed due to COVID. And so they will be making appointments with us. The other thing I just wanted to briefly talk about, and it's a requirement in one of our grants, our peer counseling grant requires us, all of our grants require us to do some quality improvement projects. But our peer counseling one also wants us to present it either to like a board of health or a community organization. So I thought this would be perfect to kind of share with you guys, specifically because it does involve a lot of the work that we've done with breastfeeding in Carroll County. And so last year, our quality improvement project for our peer counseling grant was to kind of pull together like St. Anthony's, the OB staff, and the IBCLC, and kind of work jointly on some goals and missions around breastfeeding, and specifically to do some area training and also to do some consistent messaging around breastfeeding promotion in honor of in August when they have National Breastfeeding Month. So I just wanted to present some of the things that we did, and I'll just highlight a couple of things. But we did work with St. Anthony. We had a couple of meetings with them, some of their OB staff, some also their marketing and their education department. And the first thing we did was we were able to pull off and have breastfeeding training that was held. It was actually held last February. So it was in February of 2019, and it was just breastfeeding for Iowa communities. And that was important to us. We wanted to get something more local, because sometimes for our nurses or any of our providers to take, a full day off and maybe go into the city and get a training, it doesn't always work well with, their practice and appointments and all those things. So we offered just a half-day training locally, and we did have 27 participants that participated in that last year. We are actually in the process of working on offering that again. This time it'll be held up in Lake City, just to kind of pull from more of our little bit northern counties. But we did have that scheduled actually for July 16th, but with COVID, we're going to postpone that and wait a little bit. So there will be another training opportunity for that. The other thing that we've worked a lot on in our peer counseling grant and just in WIC is, I was going to go back and look exactly, but I'm pretty sure in the 2010 China Hemp Needs Assessment, one of the things that was identified was training and getting like CLCs or IBCLCs in our area. And so that was identified, and that St. Anthony's trained, and they have Alicia Detlinger as the IBCLC. We trained initially our dietitian, Brenda Densmore, she's a CLC. And then in 2018, we trained a social worker and an additional dietitian. So just in Carroll County, we know we have 4 trained staff that can offer support to those breastfeeding moms. So I think that's huge, considering we came from not really having any to at least 4 that we're aware of. And there could be other ones that are taking training or planning on training. So our quality improvement project was to kind of look at how we're working with our community partners around breastfeeding promotion and education, and try to kind of pull everybody to a consistent message. And one of the other things we did was try to promote breastfeeding during the month of August. And some of you might remember one of the things we did is we did do an ice cream social that we held at the hospital in Manning. And Alicia wasn't able to join us that day, but she was planning on being down there. But it turned out really, it was a great location to have it. We had a lot of people stop by. We had some grandmas that were expecting, new grandbabies. So it's always nice to touch base with them too. And so we just continue to work with some of the partners. We did just some messaging on Facebook about breastfeeding. We also did in the communities, we did a little basket. It was just like a little nursery basket, and it had just little information and facts about breastfeeding and the value of it and the importance and that. So it's hard to believe we're almost a year later and getting ready to do some other things this August for breastfeeding promotion, but it might look very different because of everything that's going on with COVID and just how we outreach and promote and all of those things. So any questions?
When's that health clinic again?
That health clinic is August 18th.
Okay. And what's that time?
4 to 7.
Thank you.
Yep.
I guess, Paula, are you seeing an increase or decrease in services in the last few months, or requests or new clients?
Good question. I'm glad you asked. I always try to make notes of what I should remember. And yeah, from March to April, we saw, well, March to April to May, we saw 125 increase in our WIC participants, which for a small, I mean, I think it's a pretty substantial increase. We're still providing services basically by telephone. I think our clients really appreciate that. Some of them I think would be willing to come to clinic, but since the waiver is in place, USDA extended the waiver. It's technically extended through September 30th. Right now, the state is saying through July 31st. We could potentially start to looking at doing some clinical services, Because it is impacting us financially, especially with our iSmile program for dental services. And then because of lead, we're not doing any lead screening. So it's definitely hurting our lead program because there's absolutely no income into it. And all of those kids are getting missed for lead screening. So we'll have a lot of catch up to do. But so we'll look and reevaluate each month to see if we should start doing services. But you know, I think our main goal is just to protect our clients and keep them safe and peace of mind of them, you know, coming in and out of clinic. You know, right now it's working really well. We are able to get a hold of everybody. And we've actually seen an increase like in our maternal health numbers just because moms are more willing to take a call rather than spend maybe another 30 minutes in the clinic when their kids are done and running all over. I think it's just worked really nice because they're at home in their environment where their kids can kind of play and entertain themselves, and they can still talk with our social worker and nurse. So we've actually seen our maternal health numbers increase also.
All right. Anybody else have any questions for Paula? Okay, then we will move on to Carrie, environmental health.
Okay, I sent May and June reports and then June's claim. Did everybody get that? Yes. Okay.
Yes.
Unless you see something in the reports that you want to discuss further, they're pretty straightforward. I've been in Crawford County a lot in the last 2 months doing septics. So we're staying busy with septics, water testing. I need to get out and start doing pools. We've only had two of our 14 pools that are not going to open. The rest of them are. So I need to get out and get those going, but I still have time to do that too.
Gary, what two pools are not opening?
Coon Rapids and Glidden.
Okay.
The rest of them are opening. Charter Oak, I got a call from them Tuesday saying that they were filling their pool on Tuesday. So I don't know how much good use they're going to get, but they're planning to open. So
I didn't know they even had a pool.
they do. Slushwig has a pool, so and they were planning to open. Vale's pool closed, but they closed a year ago, not because of COVID, but they just closed because of repairs and cost, and they can't afford to keep it going. But everybody else is open. I just need to get out there and do those. On a non-health related note, passports, if we got an email from the U.S. Department of State the other day that said they're receiving 133,000 passport applications a week. They are 1.51 million passports behind because they're only issuing 236,000 passports a week. So there's 1.51 million passports sitting in their possession that they have not been able to get to. So
Wow.
if you need your passport renewed, or if you have a need for a new passport, you better get going on it because you may not get your passport until.
Can you share those statistics or can I
I
update
did.
my thing?
That's what I gave you.
Okay. I'll
Yeah.
update my post.
So yeah, I hope nobody's planning to go anywhere the rest of this year. But we've had a lot of people since the courthouse has opened come in for applications for their kids because they're planning to go to Mexico in December, and we're like, you may not get anything because we've got people that applied back in February and they still have not gotten their passport. So
They are processing. It just takes so long to process.
they are processing because they're processing the first week, June, July, they processed 236,000, but they're getting 133,000 in the same week, and they're still sitting on 1.51 million. So they're trying to catch up. They're not at full capacity employee-wise. So it's gonna take some time until they get through their stages of opening, and get back to full.
Are they providing any leeway on like an additional grace period or anything after the passport expires because of this backup?
No, I haven't seen anything. The only thing they're doing is if you have an emergency, like a death or something that you have to leave, they'll give you 70, if you do it within 72 hours, that's the only emergency, anything that they're doing.
Good.
So other than that, I don't have anything unless you have any questions for me.
I'm okay.
I probably do need a motion to approve the claims since you can't sign them.
Anybody want to make a motion to approve the claims?
I'll make that motion to approve the claims for June.
Okay,
We have just 1 month.
Yes, just June.
Okay.
okay. Anybody with a second?
I'll
Okay.
second, that's fine.
Okay, Dr. Heim. All right, all in favor, say aye.
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 All right, motion carries. And I guess anybody have any other questions for Carrie? Then we'll go ahead and move on to Megan.
Alrighty, so I sent out the May and June claims and reports. Hopefully you all got them. So the June report would have been for the end of the year. So not all of my revenue actually is on there. I saw revenue coming in for June, but it's not, I haven't received it yet. So essentially though, the reports are good. Over revenue, under expense. So no concerns with those. Are there any other questions with those?
I didn't see anything. Should we go ahead and make a motion to accept those claims, pay the claims since we can't sign them? Anybody wants to make that motion?
I'll motion.
Okay, Dr. Heim. if
I'll
we can get
second.
Second from Dean. Okay, all in favor, say aye.
Aye.
All right.
Alrighty, then the second thing is the electronic visit verification mandate that's coming. So I sent the IME letter from DHS along with my stuff, just so you could kind of see what I was referring to. It actually started in December of 2016. They passed the 21st Century Cures Act is what it was called. They've been kind of pushing it down the road. They were going to start it in 17. Then it got pushed to, I think it was 19. Then it was going to start in 20. Well, now it's officially starting January 1 of 2021. So, and I got official word on that March 19th. Not a whole lot of time. The good thing is the state is going to provide, at this time anyways, the program for free, which is huge. So we won't need to purchase the program right now, but what we need to do is purchase the devices for the aids. So they're gonna have to go into the homes with these devices so they can chart in, chart out with the documentation. So it's all like verified electronically now. So I got some different quotes. Dalton helped with the IT. They have a contract with Verizon. So he reached out, got some quotes on some, we're looking at getting iPads. And then essentially the question was if we get the iPads that have the built-in data or if we get iPads and then buy hotspots. because essentially the aides are gonna have to be connected to the internet for all of this to talk to each other. So, any questions with all of that so far?
Do you know what direction you want to take, or are you asking for
Um,
suggestion?
so, and I guess I should say that the nice thing right now is I have the money in my budget because I budgeted for health insurance for an employee who didn't end up taking health insurance on my most recent hire. So I do have like 21,000 in the budget because I budgeted a family plan. So we're good there, thankfully. I was kind of thinking going with the devices with the plan on them already, the data in it, just so then the aides aren't carrying around 2 devices that could potentially break. Or one
I think, yeah, I think they're a little bit more reliable than the hotspots.
Yeah.
I know we've got one of those iPads with the built-in so that it can talk to um, the feeder wagon for feeding cattle. So yeah, I guess that would be my suggestion. I agree with your recommendation there to go with the built-in cellular.
Okay.
Yeah.
So yeah,
And I don't have any problem with it. And I talked to Megan about this earlier. It's kind of frustrating. I mean, obviously we have the money available, but had our budget been tight, why don't they tell us this, in June or before the fiscal year so that we can put it in the budget. And that was my only comment.
Yeah, and I guess a concern would be, is the programming free this year, but down the road it's not going to be free? Because usually those software packages, those database subscriptions can get pretty pricey. But
yeah. And I
what do you do?
I reached out to some other agencies to kind of see how they're doing things. So a lot of agencies are already doing electronic documentation. So the state of Iowa is actually allowing them to, they're calling it like data aggregation. If they're paying for a service right now, they're going to let that agency kind of talk with them. So a lot of the other agencies I've reached out to, it's nothing new for them. Just because they're already doing the documentation, and it varies on what they provide for their aid. Like Carroll Area Nursing is doing mini iPads with a hotspot. They didn't really have one way or the other on that. They just said that's what they're doing. I talked with Nikki a little bit at St. Anthony's, and I know she said they weren't all fully electronic. So I know that was something they were going to be working on too up there for their people. But yeah, so I guess, yeah, my recommendation would have been to go with, and I typed up that kind of the letter. I know it's kind of hard to read the different options. But I kind of liked option 1. I did hear back from Verizon, and they don't offer any data protection, or not data, sorry, device protection. But they do have some good deals with like the cases, but I don't have what that is. He couldn't get that to me. Because that would be the only other thing I would need to get, is to get some kind of, heavy duty case or cover to put on these iPads, since the aides are going to be carrying them in and out of the homes and their cars. So we hopefully can prevent damage to them, I guess.
Yeah, that'll add up too. But yeah, they definitely need that, the screen protector and
Right.
some sort of exterior. All of the clients are, obviously they're within Carroll County, right?
Right.
Are there many that are in the Manning area? Because sometimes reception can get dicey in different parts, even with the built-in data.
Yeah, we don't have as many, I guess, in Manning, you could say. Our outlining counties are a little bit smaller number. I mean, the bulk of our people are here in Carroll County, but
Because I guess that, between US Cellular and Verizon, whatever's more reliable throughout the county would be a consideration too.
Sure. And it sounds like, so there's a whole web page design or kind of laid out for what this electronic visit verification stuff is all about on the DHS website. And right now, the company they're going with, it's called CareBridge, and they're hoping to get like a pilot program started in July and then trainings going. Because like I said, it's starting January 1. So that's, I guess, kind of why with your guys's, I guess, blessing or recommendation, I want to purchase these devices so we can move forward with.
Do you want approval for this at this meeting, or do you want to come up with the total amount that it's going to cost? And it really doesn't make me any difference. I'm okay with approving it. Which plan were you going to go with, the Verizon or the US Cellular?
Well, I had kind of thought the county currently goes with Verizon, I guess. They have already, other departments have plans through them. So we were given a discount on the devices through them. The devices through Verizon were $100 cheaper than with US Cellular. I know there's the difference in the data, but I mean, I guess I don't, it doesn't matter to me one way or the other as far as which company we go through.
How soon do you want to purchase?
What was that?
How soon do you want to purchase?
I mean, probably, I guess I don't know how long it's going to take to actually get the devices in hand once we order them.
A long time.
But with it being almost middle of July already, I was thinking sooner than later.
Okay. Then we better make a motion then to approve purchasing the device. We just won't have a dollar figure to approve at this point.
I agree, because with all the schools purchasing this for online learning, I mean, we had to get some hotspots for public health and they took like 3 months. Because the Verizon is behind and the stuff ships over from China too, so absolutely get started on ordering that.
Okay. Does someone want to make a motion to approve purchasing devices?
I'll go ahead and make that motion, and I guess to purchase the plan that best works for the county, for the Board of Health, and for the home care aides. And then, Megan, if you can just send us the amount, email us the amount, when you know what it is.
Okay, so then, because there will be the monthly cost of that data package for each device. So that will be, an ongoing.
Sure.
It's $26.95.
Oh.
But yeah, so, and like I said, since I do have the money in my budget, we should be fine this year for budget for this. And then I'll just, have to look at it for next year.
Kind of sounds like something that probably needed to happen anyways.
Yeah, I mean, like I said, pretty much almost, I can't say all, but I think the majority of agencies already are doing electronic documentation. It's just, It comes with a cost, so.
Okay. Well, Dean made the motion and Julie is making a second. So with that, all in favor? Aye.
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 And then, I'll send out, once I get exactly what it's gonna be, the cost, and that, I'll send out an email so everybody is aware of what it was.
Good. Thank you.
All right,
All right.
thank you.
Sounds good. Thanks. Okay, Sarah, public health nursing.
Okay. So, did everybody get a copy of the stats and the financials that I sent out? Pretty much. Okay. Looking at the stats, we can tell that we've been down the last couple of months, but that's because of COVID. We have started going back out into the community, nursing homes, assisted livings, to do more foot clinics. So, which that's great. And then we're going to be talking about when we're going to go out again doing blood pressure clinics. So we'll start to see our numbers go up in those categories. The Care for Yourself program, that's doing really well. I believe Beth has that almost full of people who need to take advantage of that. Financial wise, just looking here real quick. The bioterrorism that we're using, we pretty much ran out of money from COVID. Just because of COVID, and that's a lot of our time is going to that right now. And now we're in the new fiscal year, so that's going to help us out. Does anybody have any questions with the financial report or the stats? Okay. Little update on COVID-19. Currently, we have tested, as of right now, Carroll County has tested 2,175 individuals. 2,064 are negative. We're up to 104 positive cases, which that gives us a 4.8% positivity rate. But yesterday we were up 6.9% for positive cases. So even looking at our graph of seeing are we going up or down, currently our cases are on the rise. And I guess we'll have to see what's going to happen in the next week or two after the 4th of July to see how well we social distanced and where we all went. So currently what we're doing is we're still doing all of our case investigations. We're doing all the contact tracing. Everyone who's tested positive, we do call them daily just to make sure they're okay, make sure that their symptoms aren't getting worse, see if they actually maybe need to be in contact with their provider. I also know that McFarland, St. Anthony, I believe Manning is also doing it. They have people on call lists, so they have doctors or nurses calling patients daily or every other day also. So the people that are testing positive, they're getting a couple of phone calls, just making sure they're okay. We are still strongly recommending that people wear masks. We are putting out a lot of stuff on our Facebook page, hoping people do that. And I know that we are outside and people think they don't have to wear them, but we still do need to wear them when we can't social distance very well, even when we're outside. We need to make sure that we're still washing our hands, using hand sanitizer when that's available also. Not only protecting ourselves, but we need to remember we're protecting our loved ones, our friends, our family, our neighbors who can't protect themselves or who have some kind of an underlying issue that we might not know about that makes them more vulnerable to COVID. So currently that's where we're sitting. Do you guys have questions with that?
Could you just quickly do the numbers again?
Sure, absolutely. Good. All right, so
2175 tested.
Yep, was tested. 2,064 are negative.
Okay.
104 positive, which gives us a rate of 4.8% positivity rate. And yesterday we had a 6.9% increase in positives.
Thank you.
You're welcome.
6.9% increase or like overall positivity rate for the day?
That was for yesterday.
Okay.
The positivity rate for yesterday.
Is that a reflection of not doing any of the tests over the weekend though?
I'm sorry, what was that, Dr. Hein?
Is that a reflection of the state hygienic lab not running any tests over the weekend?
Yes. Yes, because I think on, what is today, Thursday? I think Monday or Tuesday, it said we had a 0% positive rate of the day before. And
yeah,
you're right, Mr. Hein.
We didn't get any of those tests back from the weekend until yesterday. So I think that's like 4 to 5 days worth of tests all on one day. So it is a lot, but it is kind of a reflection of the testing not being done over the holiday.
Okay, right.
And roughly how many people are testing a day locally?
I would say in our clinic, we probably test at least 10 to 15 every day.
And I'm not sure what test Iowa's doing currently per day. I can get that information and get it out to you guys.
I'm not exactly sure either, but I do know that last Monday, not this past one, the one before the holiday, I actually had sent a patient up from the clinic to get tested there, and they had closed early because they weren't doing as much. But I don't know for sure if they've seen a little bump with the holiday or not.
Okay.
So Dr. Heim, are your testing numbers included in what the public health nurse reported?
Yeah, so if we send them to the state hygienic lab, they get all those tests together. If they go to LabCorp, I'm not sure how those get reported to you guys or not, or if they get reported.
If they turn out positive, they get reported to the state through LabCorp.
Yeah, so we have, I mean, I would say we're trying not to use LabCorp as much because it's taking them so long to get our results back, and they've expanded the criteria for testing so we can test a lot more people to the state hygienic lab. So I would say, you know, the numbers that we're getting are negatives from the state hygienic lab, but I will say there was a good portion of the people that we tested for a long time that didn't qualify for state hygienic, and a lot of those were coming back negative. So there are a lot more negatives that come back from LabCorp than probably state hygienic. Because I think maybe only a couple of the ones that we've sent to LabCorp have come back positive. The rest of those are coming back negative. So, I mean, I suppose there are more than negative than we might know.
Well, and I know there was a mandated order that came out March, I bet, that all negative and positive were supposed to be reported to the state lab, or to the state. So hopefully everybody is doing that, but I'm not sure.
I mean, I would assume they probably are. I'm sure McFarland's probably doing something when we get those back.
Yeah. And I just talked to the people up at Test Iowa, and they're doing about 60 tests a day.
Sarah, did you hear anything about Test Iowa? We had a return to learn meeting today at Carroll, and somebody mentioned, well, Test Iowa had 3 false negatives just in Carroll County alone. Was that a rumor, or was that somebody we had 3 false negatives?
I've not heard that we had 3 false. Did they go back and get tested again?
I have no idea. Somebody just said that, well, I wouldn't go through Test Iowa because they have false negatives. It was just somebody interjecting their opinion about the validity of the Test Iowa in Carroll.
Those tests are very valid, and nurses doing those tests are the same ones we're doing.
So
that could have come up, Sarah, because there's a big ordeal with the Dowling baseball team, how they're #1 team in the state, and their coach initially was told he was negative, and they played yesterday, and then they got a call, said, oops, we were wrong, you're actually positive. So I've been hearing buzz like, oh, well, how many times are they telling the wrong thing? And now that team, they had quarantined last Thursday when they thought he was, when a potential exposure. Then Monday they found out he was negative. They played their game. Then the next day or yesterday, they found out, oops, we told you wrong. You're actually positive. So they have to go back into 14-day quarantine. So they can't compete for state championship. Their season's done. So that's kind of been a big buzz around. That might be where people are questioning validity now.
I see. I guess also a COVID update is, I know all county schools got their return to learn plans submitted, but what they submit's not set in stone of what they're going to be doing. I guess, and Dr. Hein, you can interject too, but I guess when somebody gets a positive, say a child does, and then we have to bring their siblings out, I feel those schools are going to have to go into some kind of a hybrid teaching, where teachers are going to have to be live streaming all the time, so students that are in quarantine for those 2 weeks can still learn. So I know we have a lot of work. It's going to be day-by-day changes for school, I believe, this year.
Yeah, I imagine it's going to be a mess, but I think that there's going to be people that don't necessarily have the opportunity, well, for whatever medical reasons, aren't going to be able to attend school probably like they normally would because of the COVID risks. So I think having a hybrid is definitely a good idea, especially for those older classes. I mean, I'm sure if a kindergartner has to miss a week of school, it's not the end of the world. But, when they're, doing their math learning and things like that, it's probably 2 weeks is a huge chunk. And if you have to keep these kids out for the duration, even these asymptomatic kids, they could totally sit on a computer and do this homework. So I think a hybrid is, and that's going to be the difficult part, is for people that don't have the access, getting them access to that homework, or even having someone that is able to supervise them to do that. I mean, not all those parents are going to be physically able to do that because of maybe their education level or understanding of what's going on, but it's going to be a struggle for sure.
Right. Yeah. I don't know what's going to happen.
So Dr. Heim, on the school committees, they're asking for, obviously they talk to Sarah a lot. They're asking for a doctor that would be willing to sit in on these county-wide school meetings. It's going to be different than the Friday county meeting. It's going to be just specific school answers. So your name came up a couple of times. Are you willing to be the doctor to kind of represent the county school?
Yeah, I'd be fine doing that.
Okay. So
just have to let me know when it is, what it is, and where to be.
okay. So, and then Carroll Community School was wondering if you would be willing to talk to all staff back when they bring all the staff back on Wednesday, August 19th. They would work around your schedule, but they were wondering if you would set aside that day and come and address the entire population of staff on the all staff back day.
Yeah, that should be fine. Let me look at my calendar here real quick while I got you. The 19th, you said?
Yep.
Do.
And just like whenever you show up, they'll put you right on, and then you can take off as soon as you're done.
Sure. Yeah, I can.
General overall guidance, because we had a return to learn meeting this morning, and they talked about, do we need to temp them when they get on the bus? Do we need to temp them when they get to the school? And we only have 2 nurses for 1,700 kids, and those nurses are feeling very overwhelmed. And they're saying, well, why would we temp them once they get to school when they've already ridden the bus? So the nurses feel like if you're going to temp the kids at some point, it would be before we got on the bus. But then they get into the whole, well, then a kid has a temp and you're leaving them on the side of the road and they have no parents. That was already at work and the kid just walked down to the bus stop. So yeah. I told them that I thought we should, from day one, be teaching the kids what the symptoms of COVID are so that they tell their parents that morning before they even go to school. They asked when all this baseball, softball started, I talked to the softball coach and he said on the first day of practice, they asked the softball girls, and there's 32 of them. I want each of you to name a different symptom of COVID. And not one single high school student could tell the 2 coaches one symptom of COVID. So they were like, well, maybe we can get some sort of 1-page handout. It's kind of just like something we can send home that says initially, if you feel this way, first of all, tell your parent, I feel like the education has to start with the kids.
Yeah, I think the American Academy of Pediatrics came out with kind of a recommendation document, and I reviewed that. Also, I believe the CDC is going to come out with a recommendation next week about school. So we'll have a little bit better idea there. I think there's a lot of emphasis on kind of mitigating the risk, but not eliminating it. I mean, these kids are all considered low risk for complications. And I think, depending on how reliable the parents are, it could be how reliable they are at taking temperatures every morning. I mean, anybody that works in the school system, and I will tell you from where I work, there's a lot of people that'll be like, oh, here's some ibuprofen, we'll get you till noon. And that's a really bad habit that people have, and they need to know that that's not okay. Um, and it really actually kind of starts with employers being a lot more open-minded about having their employees go home. I mean, if you've got any kids at all, it's going to be very difficult to continue to work without a little bit of leeway from employers as to, these kids need to stay home when they're sick. And sometimes that's 3-4 days. Our testing fortunately has gotten faster. So, sometimes those kids are out until they have a negative test. And I don't know what that policy is going to be for the school, what they want to do. Those tests are not 100%, but they're pretty good. But if we're keeping kids out for 2 weeks every time they get a fever, I mean, there will be some kids that barely go to school. So, and if they have a snotty nose, they'll never go to school. So I think there's going to have to be a lot of kind of school policies as well as employer policies. And there's just going to have to be a lot of things that kind of everybody has to work together for, unfortunately.
Yeah, and I know that they're going to ask Sarah that next week because they asked that same question. So if they've got the symptoms, can we make them go get a COVID-19 test? And I said, you can't make anybody do anything, and then if we sent them home due to COVID-19, then how many days before we can let them come back? So they're just looking for a lot of guidance from you and Sarah on, because they haven't, like Sarah said, they've submitted their plans, but nothing has been announced to parents because they haven't chosen what we're doing yet because there's just so many things that they still need to decide. We met for 2 hours again this morning.
Yeah, there's lots of variables. Do you guys have those plans that I could look at by any chance and kind of find holes or issues where I could kind of,
It's very generic, but I can email them to you just so that you can submit it, and then to fill in the detailed stuff after they talk to Sarah about more of the details.
Yeah, I mean, I think with anything, like I said, the test is not 100%, but we have to do what we can with what we've got. But I think if, there's other things that make people sick, especially kids. I mean, the average kid gets probably 3 or 4 upper respiratory infections a season. And most of those things are not as contagious as COVID, but they look like COVID. So unfortunately, it's so hard, especially for those little ones, because they don't respect each other's space at all. They're all over touching each other all the time. But I mean, keeping them home isn't always the best solution either, because 9 times out of 10, it's a virus that's not COVID. So yeah, I mean, I would love to look at those plans and kind of look at some ways where, I mean, this isn't going to be perfect. Somebody with COVID is going to go to school and 4 people are going to get it and then they're going to take it home and blah, 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 blah. But we got to do the best we can. And it can't be like what we did last year when we all stayed at home and tried to teach these kids from school, because that was a nightmare.
Sarah, have the schools set a target date of when they will announce what the plan is?
So I know John Steffes was over talking to Casey because they kind of want to be on the same page, right, Sarah? I mean, we have shared classes. It's shared with our WEVA, the DMAC shared, the FFA shared. So there's so much shared stuff between Kemper and Carroll. So they said, okay, we're gonna have a return to learn today. The countywide meeting is tomorrow. The meeting with the superintendents and Sarah is on Tuesday. And then the school board is meeting the following Tuesday, the 21st. So they are hoping, after a discussion with all the schools next Tuesday, and then to go back to their school boards and talk about it on the 21st. They're hoping some sort of announcement will be in that week.
Okay. Yeah, that no one wants to buy school clothes or school supplies until,
Well, and transportation is a big thing because they might eliminate transportation in the 2 miles in town, which you're not transporting kids in town. That's going to be huge. So I told him, I said, I really, really feel strongly that you need to start sending some of these surveys out and see where people are at, because they sent out an email saying, if you're able to transport your kids to school next year, please plan on doing so. But they have no numbers as to which parents said, okay, this year I'm going to make it into my schedule that I'm going to take my kid to school. Make sense? So until they start getting some solid numbers on, oh, these 25, 35 families are now going to take their kids and they've never taken their kids before, that's going to alleviate some of these bus routes. Because another thing driving the bus routes is they had 6 bus drivers retire last year, 0 applicants, 0. So you're transporting all of Kemper, all of Carroll, and 6 retirees, no applicants. So I've been telling them, we've got to tell these people this. If you're not going to bus in town, that is going to be huge. Right now there are 200 bus stops in Carroll, the city of Carroll, 200 bus stops. So if they take that away and all these people were relying on their kid getting to school via the bus, there's another problem. So, I mean, they're very, very held up on the mask situation, which we talked through that quite a bit this morning. And I told him, I said, you might have a plan that requires masks on the bus. But if they're outside for recess, maybe we don't have a mask. So that's a huge thing, Sarah. They said they're all held up on the mask situation. So it's about 50-50, and they keep hearing from several families. Kemper sent out a survey. They said that they've gotten several. They said a majority of the responses said that they wanted the kids in school 5 days a week. So, I mean, both schools are working towards that, but I feel like busing is a huge thing. But if people need the bus, then you're going to have to require masks on the bus, because the guy said it would be minimum 2 per seat. They're going to try to get away from 3 per seat, but you're still going to have 2 kids per seat.
Okay,
Well,
I just wanted to make sure, you know, one of the last countywide meetings, I very distinctly remember Carroll's superintendent saying that we will work towards who we are legally obligated to bus to, you know, get on top of that. And I knew that within 2 miles of a school district that they're not legally obligated. I didn't know if things are so tight that they would also maybe not bus Kemper kids like by Breda.
No, they haven't talked about that. That's not on the table.
Okay. Whew.
K through 8, 2 miles, high school kids, 3 miles. So you don't have to bus 3 miles out.
They're gonna start letting those kids ride their bikes to school? Because right now you can't.
What was the question?
So they're gonna start letting kids ride their bikes to school? Because right now you can't.
Well, that would be a good thing to bring up, because they talked about too, there's a foods class that goes from Carroll High over to Carroll Middle School to utilize a kitchen there. And there's 30 kids in that class. And their policy states if a bus is offered, everyone has to ride it. So they did say that they were going to open up that policy, because if 10 people want to drive over, then 10 people can drive from the Carroll High to the Carroll Middle School, and there's only 20 on the bus instead of 30. So any suggestions that anybody has, these school leaders need them. They are, like Becky said, what's the target date? Parents want to know the target date. They are hesitant to pull the trigger.
I have to leave the meeting right now. I have another Zoom meeting at 1 o'clock. So I'll probably see most of you tomorrow.
yeah.
Thanks, Steve.
I do think with the busing to school, I think it's a lot easier for some parents to get their children to school before 8 o'clock. But there are some people that have to be at work. And even right now, the drop-off time is 7:45 at Kemper, for example. And I know there's some people that's a struggle because they have to be at work at a certain time. And by the time they drop off and get to work, they can't get there. But definitely after school, because if you have working parents, you know, a 3 o'clock pickup time is just not an option for a lot of these people. So unless you've got friends or somebody else that can drive people home, even that 2 mile radius, I mean, I live within 2 miles of the school, and if I'm at work till 7 o'clock and I start at 7, You know, if my husband's out of town for work, then I don't have someone to pick up or drop off my kids because of the time of the day. So I
Right.
think it's very easy to say, well, they live within this radius, but for a lot of those kids, if their parents are working, that 3 o'clock pickup is very, very difficult.
And it's going to get even worse. It's already a cluster from heck. I can speak on the Kemper side of it, both buildings. And now if you have even 10% more drivers, let alone
Right.
potentially 50% more, huge traffic jams. It's just going to be a disaster.
Well, I think that that's stuff that we need to bring up to them, because even Larry Leslie suggested this morning, he said, why aren't we hiring just a TA, not a teacher, a TA, to have more study halls? Just you hire a TA and all your job is a study hall, and include a study hall at the end of the day. I mean, Carroll is adding the after school program like Kemper has, but it's very limited. It's, I think they're maxing at like 45 kids or something. They're starting small. So if the schools would be willing, again, to solve the transportation problem by adding a 45-minute study hall at the end of the day, and the pickup time can expand to 4 o'clock instead of 3:15, or adding a second location of pickup, you know, St. Lawrence, walk some of the kids over to the north side of the church, makes sense? Where 6th graders are picked up over there, whatever it may be. They're looking for any and all suggestions how to make this a go. So if anybody has ideas, Michelle, Sarah, I mean, if you guys can speak up and help them at this countywide school meeting next week. Michelle, we'll get the time for you on that. Sarah, what time is it? Is it 1 next Tuesday?
1 o'clock. It's 1 o'clock at the Adams boardroom, Adams Elementary boardroom. But if we have more people, we're going to have to move it to the Kemper, to the library at the high school, because the boardroom can only hold 6 to 7 people, social distancing.
Yep.
And that's on Tuesday next week.
Yes.
Yeah, I work on Tuesday, unfortunately.
Oh, okay.
But if you guys want to send me that stuff, I can take a look at it and just put some notes on it. I mean,
yeah. But like
I mean,
you said, you're a working person with the transportation. I mean, what I've been telling parents all along is they've got to speak up, because, and if these schools get the surveys out, I feel like that's really going to help us at least see some numbers as to who can take their kids to school, who absolutely cannot take their kids to school. And same with the drop-off times. I think Carroll used to be 7:45, and we're now 7:25 in the morning. So they went back 20 minutes 2 years ago, just because we had the people that needed to go to work and they needed to drop their kids off. So it expanded the breakfast program, and it gave the kids a warm place, and the parents were confident dropping their kids off at least 20 minutes earlier. So
yeah.
have to look into expanding theirs.
Well, and once the determination is made too on the busing situation, there's going to have to be a pledge of commitment from employers throughout Carroll County too, to you know, maybe stagger work start times. Or I mean, I know in healthcare it's pretty difficult to do that, but you know, Pella and Farner and all these places, there's going to have to be a strong commitment from the chamber to reach out to all organizations to say, what can we do to help parents get through this time and not dock them, you know, for having to
Right.
leave or come late, or, you know, running kids back and forth.
Yeah, and say we're taking sick time off too. I mean, if you are a 2-parent work outside of the home family, one person is always going to end up having to be home for that period of time. And, you know, most people have only so much PTO or sick time or vacation time. And it's going to be a shame if parents are blowing through that first 2 months of the year, and then their employers, I mean, from my side, I get this all the time. You know, they want notes. When can I go back? I can't tell you when you can go back. Unfortunately, it's not how it works right now. So they have to be more flexible.
Because it doesn't matter what we do at school. I'm telling you, if those buses are full, that that is how the coronavirus is going to spread with those kids, is on that bus.
Oh, yeah.
I started driving my kids last year because they were 3 to a seat and standing in the hallway. And I had a 5-year-old. So I'm like, I am done with 3 to a seat and this many people. So I made it work. But like Becky said, it's going to have to be an entire community working together.
Right.
If the transportation thing is, and it is, we are held up on the transportation issue.
Right.
Well, I know we could keep discussing this for sure, but Julie had to, I think, okay, she logged out. Okay. I was just gonna say something before she left, but I know the last thing on the agenda was the Board of Health recommendation that Heather Bombi had forwarded to me. All chairs of Board of Health in her region, Story County Board of Health, wanted to share it with the other county boards of health and see if they wanted to model and do anything similar. It it was nice information. Obviously, in Story County, they've got a different situation with Iowa State and with football games and things like that. But I asked Megan to forward it out to everybody. I don't know if we wanted to discuss and potentially model and do something, but I feel like right now, Sarah and Nikki, who's ever doing the Facebook updates, I know you guys are trying to consistently get that messaging out there. So I'm kind of torn, and if we need to have something official, that's submitted from Board of Health members on top of that. If they may.
Sarah Skinner does most all of our website, Facebook stuff, and she does a great job with it. And we also get stuff from the hospital that they put out their press releases. Then if they do that, we try to just put our stuff with it. So sometimes I don't know if there's just information overload and people just stop looking at it, or they just look for the things they want to see, like the numbers. Where are the numbers at? We see a lot of people, they're always asking number wise, and then we put out other information, and Sarah, she does some kind of statistical thing with how many people are viewing the page, how many people have shared it, and like the traffic on the page. And it's usually when we put numbers out, that's our most highly trafficked page, or Facebook, or looked at or liked or whatever. And the information, the press releases that the hospital gives us, it's great information. I just think people are overwhelmed with getting stuff from school, getting stuff from, a lot of the parents, they're getting information from their schools, they're getting information from employers, there's information on the news and things. And I don't know, I just think there's a lot of information out there and people don't really know what to look for. And maybe if Board of Health puts stuff out, it's like, this is coming from the County Board of Health. This is important. This is really, what's the word I'm looking for? Like accurate information. And maybe they don't have to sift through it then. So maybe it wouldn't be a bad idea to get something put out by the Board of Health also.
I'm sorry, I didn't really see, what kind of information are you talking about? I didn't see that document. I didn't read that.
It was an attachment that Megan sent, like with the agenda. It was just a 2-page. It was a lot of text. It was just recommendations that the Story County Board of Health made on, what people should be doing. And they made a strong recommendation to Iowa State to not have any fans in the stands at football games if they move forward with football this fall. So, it was just kind of a repeat of all the smaller messages that have been out there, over the last few months. But they just, I guess, Story County Board of Health, they were seeing a bigger spike in Story County. So they were just trying to do something authoritatively. But honestly, it came with a lot of political repercussions behind it. I think several of those Board of Health members got some nasty calls and messages because of the specific portion that was strongly urging Iowa State not to have football fans. So
yeah, I think we're in a very, I think it is very much information overload. And I think people at this point, frankly, don't care, to be honest. I think they're tired of being cooped up. They know that they have to social distance and wear a mask, but a lot of them are choosing not to. I think it's very hard to tell people, we recommend you not do these, and these things. I think people know their risks, to be honest, and I think they've chosen to do it anyway. I think that's the ultimate truth. People are aware that they might get coronavirus, but they were so stir crazy that they are all willing to take that risk. And I think that is the honest truth. I think people are fine with the risk. And that's, I feel like, the older people too. A lot of them, either one, they're like, I'm 90 years old and I don't care if I get it. Or two, they know their risk and they're only going to go to places that they feel comfortable going. I do like the ones that they send out that kind of list what their risk is based on their activity. Have you guys seen those? Like, how like you get coronavirus if you play golf or you go swimming or you go to the restaurants or whatever. I think those are nice so people know what their relative risks are for doing things. Because at the end of the day, we can make recommendations, but the state also has their recommendations and the CDC has their recommendations and the government, this and that. So if there's something specific, like, now it's flu season, we're seeing a lot of cases, maybe we need to make recommendations at that point. But like, I definitely agree with Sarah. There's just so much information and people have frankly already decided which line they're standing on and what they want to do. And that's just been my recommendation or my observation from when people come in to see me at the clinic.
Mm-hmm. Yeah, I agree. And then it also boils back to the fact that most people are just kind of functionally health illiterate anyways. It's hard to get a message across that's understood. So I think if there would be anything that we would put out there, I think it has to be little text and big pictures. Something, maybe if there's constant, pictures of wearing masks and just, the phrase, this helps reduce your risk. I think that would represent our role of helping reinforce messaging rather than having a separate, doctrine that is coming out from the Carroll County Board of Health.
I think the return to learn plan is either 6 or 8 pages long. And they said this morning, people are not going to read this. We will send it out in an attachment, but we need that 1-page sheet from Sarah and Dr. Heim. These are the bullet points, and hopefully they pay attention to the 1-page sheet. That's their goal. The other thing, Dr. Heim, when we send that to you, they're looking for the matrix from healthcare, public health and doctors as to if there would be, it seems like anybody, like Dairy Mart and Glidden, the one employee, they're closed for 2 weeks now. They're like, we cannot close the school for one case. So they're looking for that matrix or that what number triggers hybrid. They talked about, like Sarah said, when we have these kids home for 14 days, they might not have it, but the brother, sister, or the parent had it. So then they're automatically quarantined with them. So they know that they're going to have that online learning available. But at what point does it trigger closing a school, one of 4, the entire district?
Dr. Heim, what's the threshold for influenza? Is that like a 10% of like?
Oh, you know what? I don't know. I feel like it's a little higher than that.
Okay. So I don't know. Maybe I'll look into that and figure out, do you think we should follow the influenza, or because COVID is more likely to spread, or spread quicker? Do we do a certain percentage of students gone, say like Holy Spirit or something? They have 17% of kids gone just from COVID. I mean, would that be something where we should maybe suggest, oh, something's going on there, maybe we should just close that center down and they go to online learning, but everybody else stays in school?
Yeah, I don't know what the perfect number is on that, partially because, like I said, the mortality in kids is not very high. I mean, it's right. It's worse for influenza. So
a lot of the talk is the staff. So they're saying, we know that the kids will recover quickly or maybe be the asymptomatic positives, but then the staff. Because they
Yeah.
said, if we have 4 of the 6 third grade teachers out, we don't have enough subs to cover that.
Yeah.
So,
Yeah, and the unfortunate thing is too, it all comes down to, I mean, confirmed positives. There are so many people that walk around that are asymptomatic that it's very easy when you know that you have a symptomatic kid that was there and you can trace that. But it's nearly impossible when you think of how many people are probably running around the school that are asymptomatic. So
Right.
I think that's a game that's very hard to play because, if you got kids that are literally out of school, then it's a lot easier to quantify that. But because there's such a high prevalence of asymptomatic positives, I don't know that you can use how many kids have it. And maybe it is more of a, do we have the capacity to continue to teach these kids? If not, we need to stay home. And that's true. I mean, it's the older staff that are at higher risk than the kids. But like I said, they're just as likely to get it at Walmart. You know what I mean? Or
Right.
from someone else at home. So it's so hard to just say, yeah, we need to close the school because we have X number of positive cases. Because like I said, a lot of those people will be asymptomatic. So I'll have to put a little thought into that. It'd be nice to know what our flu numbers are there. But I mean, I think at any time, if it seems like it's getting out of hand, we might have to close it down, but it's going to be very difficult to just put a number on that.
Right. Okay, Dr. Heim, what are your thoughts on this? I mean, I don't think I really agree with doing this, but it was brought up saying maybe we should do a baseline test on everybody in the school, all kids and staff before they even go to school. But that's just that one day that they're negative. So I guess like a baseline test, do you think that's something all districts in the county should do? Or do you think that's a waste of our supplies?
Yeah, I think it's a huge waste of resources.
That's what I thought too.
And frankly, you'd have to do it so frequent on an interval basis that doing it one day for everybody. I mean, how many kids are in the district? I don't even know.
Right.
3,000 in Carroll, between Kemper and Carroll, 3,000.
Yeah, I mean, that's a lot. I'm not
Right.
sure. I mean, if Test Iowa wants to do something like that, I think maybe. But like I said, it's just such a moving target. I mean, they might be negative on day 1, but then 2 days later, before they get their test back, they went over to the grandparents' house and somebody there had it. Now they've got it. And they go to school and they're positive. So I just don't see that that's a huge benefit.
Okay.
And I do think it is a waste of resources.
Okay. I thought that too. I just maybe get it from a perspective of you, what you think. So,
and to be honest with you, most of this stuff would go away if we had much better rapid testing kits available. We do have some, we just don't have a lot. And what we have, we don't have huge supplies of. So, I mean, honestly, if we could get that test, and hopefully we'll have that before, flu season hits, because, once flu season hits, if we've got flu season and COVID,
right,
it'll be a nightmare.
It's a mess.
But if we have a rapid test, we can test those kids, they're negative, you can go back. We got rhinovirus, we've got RSV, we've got all sorts of other things that circulate all winter long, that it'd be nice if we have that rapid test, and it'll make everybody's life a lot easier.
Correct. I agree. Well, Dr. Heim, let's get on that and let's figure this out for the rapid test.
Rich overnight.
Yeah, we have them. We just need the tests.
Yeah, we'll figure it out, Dr. Heim.
Audubon has them with their 16 cases. But
they allocated those resources in the most unusual ways, and they're being allocated by the government. It's not like we can call the supplier and say we'd like 4,000 tests, send them this way. We can say we want 4,000, they'll be like, well, here's 100, and that's all we're going to give you for 3 months, so use them wisely.
Well,
Right.
I have another meeting coming up here shortly too. I don't know if there's any other discussion or we hit all the highlights.
I think I'm good.
Hey, Becky.
Okay,
I'm good.
all right. Well, do I still have Art on the phone?
Hey, Becky.
Yeah.
I just wanted to,
I'm leaning in.
that's, yeah. I know that public health is like a thankless job and nobody hears anything but the complaints. So I just wanted to like kind of publicly thank Sarah because I know that they have been overwhelmed as she has worked with my family, as both Kenny and Mariah were positive for COVID and cannot get my daughter out of quarantine. But I just know that, you know, they take a lot of heat for everything that they do. And she was wonderful. They look forward to her calls, even though Mariah would beg to get out of her quarantine. And it will come, I hope. But I just wanted the board to know that, like, she did an amazing job with working with my family. So.
And-
Yeah,
And
awesome.
Paula, you know what, on the return to learn guidance, 45% of schools in the state of Iowa do not have a school nurse.
Yeah.
And the return to learn guidance stated that if you do not have a nurse, you will have to consult with your public health nurse for them to get the school through. And I told Sarah, on top of everything else, you can be a school nurse on top of that for the schools that have no nurse.
Well, not
Wow.
only that, now they're saying any community schools that don't have a nurse are supposed to contact local public health to see what they can do. And I'm thinking they need to, if they don't have a primary care, they should consult urgent care. Because I can't test them. I
Stop
mean, I
it.
can, but I can't prescribe anything for them.
Well, we are working really hard to get a third full-time nurse at Carroll because we're at 2.5. And hopefully the next board meeting, we go to 3.5 full-time nurses. So.
Oh, wow. That'd be good.
Wow, so many issues coming to the forefront, huh?
Right. Yes.
Wow.
And Paul, I just want to say thank you. We have a great team that, I mean, we work with McFarland, we're working with everybody in the county to try to do this and get it right. So thank you. And
Yeah.
we appreciate your comments.
I think we're definitely lucky. We've definitely had the contact from our local provider every other day too, and definitely from public health. And I think that is important, especially those early weeks when, I quite honestly was scared. My daughter does have a asthma, which puts her at a greater risk. And for those 20-year-olds who don't think they can get their hiney kicked, she's had her hiney kicked. She's had her temp as high as 103.8. So, but it is nice just for people to touch base and reassure you, I guess, because the first couple, definitely the first 10, 15 days were scarier just because there's so much out there.
Mm-hmm. Yeah.
Okay, well, thanks, everybody. I guess I'll take a motion to adjourn the meeting.
I'll motion.
Dr. Heim, and second, if Art's not there, I'll go ahead and second it. So we'll act like he's there then. So all in favor, aye.
Aye.
And for anyone that didn't hear, our next meeting is September 10th, I believe. Was that correct?
Yes.
Thursday the 10th. Okay. All right. Well, thanks everybody, and thanks Sarah, and keep on keeping on. We'll get through all this. So, all right.
Definitely.
Thanks, guys.
All right. You're welcome. Goodbye.